everybody. It's Sarah Ackerman, Communication Specialist with Public Health Sudbury and Districts. Thanks again for joining us today. Merci tout le monde. So I will ask that as we wait to begin, you do keep your line on mute, also noting that cameras are optional. Before we get started, I'll just go over a few housekeeping items. Dr. Penny Sutcliffe, Sudbury and District's Medical Officer of Health, will provide an update on the recent provincial announcement on the emergency break for Sudbury and Districts and moving to the gray lockdown zone of the COVID-19 response framework. Following her comments, media will be invited to ask one question and one follow-up. If you do wish to ask a question, please use the raise hand feature. Those who have their hands raised will be called upon to ask their question. If you did call in via teleconference, you will be provided the opportunity to ask a question as well. Dr. Sutcliffe will respond to the question in the language that it is posed. And thank you, everyone. With that, Dr. Sutcliffe, when you're ready to get started, I will turn it over to you. Just confirming that we will start at 4 o'clock. And can everybody hear me? I think there might be, okay, great, thank you.
Sarah, it's Dr. Sutcliffe. Are we okay to get started now?
Yeah, that's good. We can hear you. Thank you.
Okay, thank you. Bonjour. Hello, everybody. Ani, thank you for being here at this opportunity to interact and exchange about what's happening in our area as it relates to COVID-19. And before we begin, I would like to recognize that Public Health Sudbury and District serves Indigenous people on Anishinaabe territory and on Cree territory to the north. We recognize that we shared this land with First Nations through our shared responsibilities with the Robinson-Huron Treaty and Treaty 9, and acknowledge the unceded territory of Wikwemikong. So Northern Ingenuity, I hope my power holds. We're having an outage right now in my home office, so we'll keep this going as long as I possibly can. And thank you for your patience should anything go wrong with this session. I will share a few comments and then go through a few slides really by way of context. But as you will be aware, the Public Health Sudbury and Districts area, because of the cases of COVID-19 that we're experiencing, including the variants of concern, has been called Medical Officer of Health to recommend to the provincial government that our area really be under the gray lockdown. So pulling the emergency brake, putting us in the highest level right now of preparedness and of prevention to prevent the spread of COVID-19 further on our area. I'm going to go through some of those those statistics and the background in just a moment, but wanted to say that in addition to that, I have issued instructions today to our area school boards and private schools throughout our area, with the exception of Chapleau area, to be suspended for in-person teaching and learning effective on Monday. So what I'd like to do is go through slides and then a few more remarks, and be happy to take comments subsequent to that. So Renee, if I could ask you to go to the first slide. So in our area, and per this slide, it was actually 1 year ago yesterday that we experienced our first case of COVID-19. So this was March 10th of 2020, and it seems like a lifetime ago now. By March 10th, so yesterday, at 1 year's time, we experienced 841 cases in total reported to us. And really importantly, 25%, so full 1/4 of those cases that we have ever seen have occurred in our area in the last 2 weeks alone. We have sadly seen 15 people who have died from COVID-19 in our area, and all but 2 of those deaths have occurred in the last 9 weeks, and all but our 7-day incidence rate, so this is the rate of new cases per 100,000 population, was 71.9, so almost 72 cases per 100,000 population, and that grew from just 2 weeks ago, where we saw just 12.6 cases per 100,000 population. So this is rapid growth, and you'll see from the graph on this slide that we experienced our first wave, we then experienced our second wave, and I would say certainly into our third wave right now. We have had some ups and downs across the way. However, I would also note that it was just in September, in the middle of September, where we experienced our 100th case, and of course now are well over 800 cases. Next slide, please. Of course, many factors are contributing to why we're seeing an increase in cases, but very concerning, of course, are these variants of concern. They're called variants of concern for good reason, and that is because they're highly transmissible and therefore cause much concern with regards to the public health implications of these mutations of the virus. We have had 3 confirmed cases, and that means that the genome has been sequenced, and we know which exact variant it is. So 3 of those have been sequenced, and we know that it's the B.1.1.7, or the variant first identified in the United Kingdom. And we have another approximate 100 cases, yes, 100 cases that are screened positive for variants of concern. And in the past week, full 48, almost half of our cases of concern. So because of the increased transmissibility, the provincial models have shown that variants of concern will become the predominant strain in Ontario. I don't know that I would have anticipated that we would have seen this so quickly here in our area, but the truth is that once the variants are introduced into an area, they are so transmissible that they quickly overcome and do become the most predominant strain that we are. So it's certainly possible that with these variants of concern and their increased ability to spread from one person to another, that they are really driving the recent increase in outbreaks and in local cases. And I want to reinforce that these variants of concern are understood to be spread in the same way, which means that it's the same measures that we need to take for regular COVID that we would take for the variants of concern, but meticulously so. So really paying very close attention to distancing and masking, really being careful about the symptoms that even just one symptom that you might be experiencing, have a low threshold for that. Stay home, get tested, and all of your household members should also stay home while your tests are pending. Next slide, please. So with regards to the variants of concern, you'll see on this graph in the pale teal color how we have rapidly been seeing more of these cases. So the red portions of the bar are those for which we've had confirmation of the actual strain that they are, and the pale colors in the last 3 bars are those where you can see the variants of concern. So you'll see the big contribution that these variants are playing to our current outbreak and current wave in the pandemic locally. Next slide. So you'll be aware that we have seen a number of outbreaks and cases in schools. So a total of 13 schools have had outbreaks declared in them, and those account for 123 cases in total. You'll see those schools and the dates that outbreaks were declared listed on this slide, and the number of cases that are attributed to those outbreaks in the schools. So more recently, we've had a total of 8 school outbreaks declared that account for 71 cases overall. So the schools, I want to be really clear, are a reflection of what happens in our community. The schools aren't the cause of problems, but what is circulating in our community ends up in our schools. And so I have absolutely held to that schools should be protected. They should be the first to open, the last to close, and that we need to do all that we can in our community to keep rates of infection low so that we can protect in-person learning in our schools. However, we are seeing rates of infection now that are too concerning and really tipping the balance in terms of the benefits of in-person learning and the risks of ongoing transmission of COVID in our community. Next slide, please. So of course, schools are not the only place that we are seeing COVID. We are seeing COVID throughout our community. And this slide shares information about the school to household transmission that we are seeing, where household cases are directly traced to cases associated with schools and school outbreaks. And the number is probably much higher than that as we continue our investigations and into the more recently reported cases. We know that from an age perspective, that from the start of the pandemic until just February, only 22% of our cases were under 20. And in the last 2 weeks, 29 of our cases have been in individuals under the age of 20. We have additional community spread. So again, not just limited to schools, but spread that we're seeing associated with fitness centers, with social gatherings, and certainly cases where we do not know what the source of infection was. So that obviously is concern around just the community transmission, that the variants and COVID is there. So next slide. So this brings us to the end of some of the facts about what we are seeing. The protective measures that are in the gray zone, so again, a lockdown zone, will continue to be examined over time, what our rates are like, what the public health capacity is like. Your public health team is working 7 days a week, not around the clock, but almost, to make sure that we're still able to do the important investigation of cases, the contact tracing, so that we limit transmission as much as possible. But we can't do this alone. You've heard me say that before. We need the efforts of every single person. And so right now, with these additional measures about staying home unless it's really essential to go out and do otherwise, to work remotely, and the further protective measures with regards to some of the restrictions on gatherings and other venues are critical in what's needed now so that we can turn this thing around. And the other thing, of course, that is so important and is absolutely the light at the end of the tunnel is the important work on our immunization programs and the COVID-19 vaccine. So we absolutely need to protect the public health capacity so that we can continue in partnership to lead that important immunization program across our catchment area. So thank you all very much, and gros merci. I appreciate the attention and your spreading the importance of this information in the critical state that we are at locally currently.
Okay, thank you very much, Dr. Sutcliffe. We now have about 20 minutes for questions. Again, please use the raise hand feature to indicate if you would like to ask a question. The first question goes to Ezra Bellette-Cousineau with Radio-Canada.
Bonjour, vous pouvez m'entendre, Madame Sutcliffe?
Oui, très bien, merci.
Bonjour, mais oui, en fait, ma question, j'aimerais bien savoir, est-ce que dans la prise de décision, est-ce que vous avez de ramener là en zone grise, est-ce que le facteur du déploiement de la vaccination a joué un rôle dans la décision, le fait justement qu'il n'y ait pas encore beaucoup de vaccination, est-ce que ça a joué un rôle dans votre décision?
Et en effet, le fait qu'il n'y a pas beaucoup de personnes qui ont été vaccinées jusqu'à maintenant, évidemment, ça c'est un facteur. Mais vraiment, il faut dire que c'est aux causes des variants préoccupants qui est vraiment inquiétant. Alors, c'est pour ça que le FREN, the outbreak, ce qui a la messagerie sans chef a été développée pour qu'on puisse vraiment arrêter d'une façon vraiment vite pour être capable de nous protéger. Parce que c'est tellement transmissible, il faut avoir comme le moins de délai possible pour ces mesures-là de protection. Non?
Merci pour mon follow-up. J'aimerais juste, si c'était possible, vous demander de nous réexpliquer la situation dans les écoles, mais en langue française.
Oui, absolument. Alors, c'est vrai qu'on a vu plusieurs cas dans nos écoles, mais nos écoles, ça reflète ce qu'il y a dans nos écoles. Alors, il y a beaucoup de bénéfices d'être capable d'être à l'école en personne, mais maintenant, le risque qui court dans nos communautés aux cause du niveau de transmission de la COVID-19, ça veut dire que maintenant, c'est plus sécuritaire que tout le monde vraiment va avoir des leçons virtuelles.
Merci.
Your next question goes to Len Gillis with Sudbury.com.
Hello, Doctor. Thank you so much for doing this today. I have to ask, Ontario and Sudbury was put into lockdown back on Boxing Day, but the PHSD numbers show that the case count continuously got higher every single day since then. So what do we draw from that? I mean, regardless of the restrictions, the numbers just kept going up. So what needs to be done differently?
Well, I do think that the numbers tell a different story now. If we look at the waves that I showed on a previous graph, we see that, in fact, we have had a tremendous uptick, a tremendous surge in cases since the end of February, so the last 2 weeks. So, in fact, the lockdown, the measures at that point in time, so the shutdown province-wide, helped us. Now, of course, unfortunately, we have more people interacting as we've gone into the orange zone and the variants of concern. So, in fact, the numbers have not continued to rise at a steady rate. We have absolutely seen a real surge, particularly in the last 2 weeks. And particularly concerning is that almost 50% of them in the last week have been these variants of concern.
Doctor, I'm wondering if there has been enough enforcement of the rules. Should people be inspecting stores and other businesses to see if the clients are wearing masks and taking the proper protocol procedures?
Enforcement obviously is one key component of this, but honestly, we do know that it requires cooperation of everybody. We live in a kind of community where we need to rely on one another. We need to follow the rules. There is enforcement that goes on that is a combination of a municipal bylaw, of inspectors of public health, and of police. And certainly there have been inspections and there has been a routine review to see about the compliance. Certainly in the lockdown that we're currently in, there is a great expectation on people to comply. It's in all of our best interest that this occurs so that we reduce the rates of transmission and we can get out of this as quickly as we can and get vaccine into arms.
Thank you.
Thank you. Next question goes to Casey Stranges with CBC News.
Hi, Dr. Sutcliffe. Question for you about the decision to close schools. Can you walk us through some of those conversations and the process of how you came to the decision to shut down the schools in Sudbury?
Yes, a good question, and it's not a question, none of these decisions that we take lightly. We have regular communication with the directors of education and others in administration in the school boards. It's been a very difficult time for everybody. My commitment has been to protect in-person learning as long as we possibly can. And what that means, what that has really been contingent on, is our keeping our levels of infection low in the community. When it's in the community, it gets into the schools. When it gets into the schools, we see dismissals and we see outbreaks and really significant disruption for our kids. The in-person learning is good from an intellectual perspective, from an emotional perspective, from a social perspective, from a safety perspective, and we really wanted to try to protect that. However, in consultation with the directors and administration in the school boards and my knowledge of what's happening in the community, the benefits now outweigh the risks, and I've made the decision that throughout our area, with the exception of Chapleau, that as of Monday, the schools will all turn to virtual learning.
Follow up, if I may. You mentioned earlier the light at the end of the tunnel is kind of just up ahead. Looking back on the past year now, is there anything that you might look at and say you could have done that maybe in a better way or a different approach to dealing with it?
Oh, this has been like drinking from a fire hose, Casey, as the year has gone on, and everybody know that we have been learning as we go and learning together with learning about the virus, learning about how to prevent transmission of the virus. Who would have thought we even would have had a vaccine developed by this point in time? So yes, hindsight 2020, we would have done differently, but we just did not know, and the science has evolved really at a tremendous pace. One thing I really want to emphasize for everybody is the real pillar role that your public health unit, your public health staff have been playing in protecting people. So the public education, the intensive follow-up of cases and contacts, and now getting vaccine in arms. Absolutely, we do this in partnership. But I'll tell you, your public health staff are certainly an army, a group of people of which you can be extremely proud for getting us this far and for ultimately getting us out of this pandemic.
Thank you.
Thank you. Next question goes to Pascal Vachon.
Oui, bonjour docteur. Je voulais savoir, est-ce que vous avez des chiffres pour prouver que les variants, que ce soit britanniques ou sud-africains ou peu importe brésiliens, se sont, je pourrais dire, infiltrés dans les écoles? Est-ce que vous avez beaucoup de cas de variants dans les écoles?
Oui, on a plusieurs cas de variants préoccupants dans les écoles. On ne sait pas s'ils sont quelles variants ils sont parce que les tests sont pas encore faits. Mais oui, on sait qu'on a des échantillons qui ont un message positif dans nos écoles. Alors ça, c'est une des facteurs, mais c'est pas surprenant. On voit ça dans nos communautés, alors et dans d'autres endroits. Alors on va les voir dans les écoles aussi.
Merci. Puis dernière question, on parle beaucoup des éclosions. Est-ce que vous croyez que ça pourrait changer la donne, les variants dans les éclosions? Si vous voulez rouvrir après le 28 mars, est-ce que vous allez être plus sévère au niveau de fermer les classes? Si vous voyez que vous avez beaucoup de cas de variants, dans le fond, ma question c'est, est-ce que les variants changent la façon dont vous décidez de fermer des écoles, fermer des classes?
Mais les variants changent nos pensées et l'analyse seulement dans la façon qu'ils sont plus transmissibles. Alors, on prend ça en considération, mais toutes les mesures qu'on a en place, on met en place pour les éclosions sont exactement pareilles. Alors, on prend pour requis que n'importe quel test positif de la COVID-19, que ce soit les variants préoccupants, pour nous protéger davantage.
Merci.
Thank you. Next question goes to Darren McDonald with CTV.
Hi, Dr. Sutcliffe. When we emerged out of the lockdown after the holiday season, there were a lot of questions raised about why schools are opening in Sudbury, and we were told that because there's a lot of challenges with remote learning around here. Looking back and considering, as you say, almost half of the new cases are at schools, was that really a wise decision?
Oh, I don't know that half of the new cases are at schools. However, we have seen cases in schools, and again, this is because we're having cases in our community. I absolutely believe, and there's good strong evidence about the importance of in-person learning, and the fact that we've been able to protect it this long is really tremendous. So absolutely stand by that, and we'll be keeping an eye out really closely for when we can start to open our schools again for in-person learning.
And as a follow-up, I noticed that there are about 19 patients at Health Science North right now who have the virus or may have the virus. I wonder at what point does that the hospitalizations and the health capacity become a concern?
So I do not have numbers on the status from a hospitalization perspective. It's a regional hospital, and the hospital will have patients of all kinds from across the region. However, I'm very preoccupied, of course, by the capacity of the healthcare system and the capacity of the public health system. And on the public health system front, I can tell you that we are nearing our human limit as it relates to our ability to literally respond to cases and contacts and to deliver vaccine. As a system, the public health system, we don't just work alone. We have neighboring health units, Public Health Ontario based out of Toronto, and our ministry colleagues that we in fact certainly have reached out to help to reinforce our workforce to be able to protect our communities.
Thank you.
Thank you. Next question goes to Rosalind Russell with Moose FM.
Hi. Hello, Penny. Hello, everyone.
Hello.
2 questions, Pen. Children child care centers, will they remain open, but they won't have their before and after programs?
That's correct. They will remain open, but the schools will be closed, and the before and after school programs will be closed. So I shouldn't say the schools will be closed. They'll be closed for in-person learning, but not, of course, for virtual learning.
Okay, and as well, the other question I had is a lot of the mass vaccinations are underway. Sudbury and Manitoulin districts is a wide area. You see a continuation of the vaccination schedule continuing despite the shutdown?
Oh, absolutely. And with the lockdown, of course, we hope to see fewer cases, freeing up more public health staff to be able to deliver vaccine. We understand from the province that we should be seeing more vaccine arriving on our doorstep. So absolutely want to ramp that up and make sure that the only rate limiting factor of getting vaccine in arms is the amount of vaccine we receive. So the shortest delay possible between receiving vaccines in our freezers to getting it into people's arms.
So I know I'm asking a third question. So people who are booked in that, don't worry, you're in.
That's right. Don't worry, you're in. And the other thing, don't worry, is that we take, you can be assured that we take excellent COVID safe precautions to make sure that it is a safe experience in going to get your vaccine.
Thank you.
Thank you. And now I'll turn to those who did call in. Jim Moody from the Sudbury Star, would you like to ask a question? You may be on mute.
Sorry. Oh, hi. Penny, can you hear me okay?
I can hear you now. Thanks, Tim.
Okay, thank you. Yeah, I'm just, and I apologize if this is already being spelled out in a release, missed it, but curious about the duration of the lockdown. I'm assuming it will be evaluated on a weekly basis, perhaps, and the determination will be made as to when we can come out of it.
Yes, that's right. And no, you didn't miss it. That we have not, there is not a predetermined date. It really is dependent on what we see. It's dependent on our actions, our compliance with the measures in the gray zone, and therefore when we can go to another zone. And it doesn't necessarily mean a stepwise progression. If we're doing really well, we could go, even to a more open zone. It really does depend on our behaviors. The variants of concern make us all really preoccupied by how we can protect ourselves, the strength of the measures that we need to take to really stop the spread of this virus, and of course, really focusing on getting vaccine in arms.
Okay, thank you. And just as a follow-up, you mentioned the variants. I've read some conflicting sort of reports about whether they make you more sick or whether they're more deadly. Can you maybe speak to that? What your concerns are as far as how these new strains that are becoming more dominant are health compared to them?
Thanks, Jim. And I do think that it is difficult to say almost anything definitive about COVID-19. It has surprised us at almost every turn. Right now, the biggest concern is the transmissibility and how easily it is spread. And although we might think that's not a very big factor, it won't impact us much, if you look at the modeling about transmissibility, because there would be more cases, we see more cases of severe illness and sadly more deaths and more hospitalizations. But right now, the concern is really about how quickly it can be spread, not so much about the fact that it's more virulent or more severe. However, studies continue so that we really further our understanding of that.
Okay, thank you very much.
Thank you. And this will be the last question on the phone line. Warren Schlote, do you have a question from the Manitoulin Expositor?
I think I'm on. Okay, I think I'm no longer muted now.
We can hear you well, yes.
Okay, wonderful. Well, thank you again for organizing this, and I have to say I'm suffering the same fate. We're currently all without power on the island, so I'm calling in by phone. Just hearing a lot of concern from people on the island that have poor internet access, especially some people are having difficulties getting through via phone to register for vaccination appointments. And even if they were able to register by internet, I do know of one individual here who had a 2-hour wait just to get the appointment part of it scheduled. So what sort of work is PHSE doing to accommodate the people who have to spend like these hours on the phone, especially for older people who may struggle with the process?
You know, what I can say is I absolutely wish it was better, and not only wishing, but working on it becoming better. You're absolutely right that the experience for some people is not the most pleasant, where it really is a long wait on the phone. With the provincial booking system coming online next week, and we will gradually transition to that, those who can book online will be able to, which should then free up our phone lines for those who don't have internet access. And so over the course of the next week to 2 weeks, we should be seeing improvements. We are also improving our own call center with regards to the capacity of the center, so doing our utmost to make sure that that is as responsive as possible. Unfortunately, right now, the circumstances that you describe are not uncommon. It is taking a long time at certain times when people call in. So we're committed to making it better. It will take probably another 2 weeks before we get to what I would call a more acceptable state. So right now, patience, we're working on getting it better. Our priority is to get vaccine in arms, and absolutely with our populations who are at highest risk right now, in particular those who this year are 80, so they're either 80 now or will turn 80 this year, that they have an opportunity to be immunized, along with highest priority and high priority healthcare workers, and certainly our Indigenous and First Nations populations.
Okay, thank you for that. And then one question that did come up with some people I was chatting with here is, there was that lottery on the weekend for the very first round of doses. Are the people that entered into that lottery still eligible for the further rounds that are happening in the next week, or do they have to re-register?
Yeah, you know, that's an excellent question, and if we had our time back, we would have been much more clear about that, but thanks for asking it. Absolutely, those who have pre-registered do not need to pre-register again. So we asked people to pre-register, then we randomly selected the number of people that match the number of doses that we had. So from that same pool, or people who enter that pool and pre-register even subsequently, that those individuals will also be randomly be in the pool that will be randomly selected for upcoming immunization clinics. So do not need to pre-register more than once. People stay in that pool for selection for the next time around as soon as vaccine is available.
Okay, thank you very much.
All right, with that, we'll bring this availability to a close. Thank you, everyone.
Thank you. Merci beaucoup.
Thank you.